Hello and welcome to this significant discussion on self-harm. Often self-harm brings to mind visible actions like cutting or burning. However, there exists a realm of less conspicuous self-destructive behaviors beneath the surface. In this video, we are delving into the subtle self-harm actions that individuals employ as a means of coping with emotional struggles. By shedding light on these less overt methods, we aim to gain a better understanding and offer support to those facing challenging times. To begin with, let's address the issue of not eating, where some individuals abstain from food entirely. They do this in an attempt to manage their emotional pain, believing it provides them control over their feelings. However, this is not a solution. In fact, it can adversely affect both physical and emotional health. If you or someone you know is consistently skipping meals, it is crucial to delve into the emotional factors at play and seek professional assistance. Eating disorders pose significant health dangers, including malnutrition, heart problems, bone density loss, and mental health complications, making early intervention and treatment are crucial. Moving on to risky sexual behavior, some individuals engage in unprotected sex, have multiple partners, or utilize sexual encounters as a way to escape emotional distress. This is not a healthy coping mechanism, as it can result in emotional guilt and anxiety in addition to physical risks, like sexually transmitted infections and unwanted pregnancy. Talk therapy and open communication can assist individuals in understanding their emotional needs and reducing the inclination for risky sexual behavior. Now, let's address intentional drug overdose. This is an extremely perilous behavior. Those who engage in it are often grappling with intense emotional turmoil and a desperate desire to escape. Drug overdose can have severe physical health consequences, ranging from organ damage to respiratory failure, and in the most severe cases, it can prove fatal. If you ever find yourself or someone you know in this situation, it is imperative to seek medical and mental health assistance promptly. Overindulging in alcohol is another way some individuals attempt to cope with their emotional pain. While it may seem like a quick fix, it tends to exacerbate problems, leading to depression and strained relationships, and poses significant physical health risks, including damage to the liver, heart, and the risk of addiction. If you or someone you care about is struggling with excessive alcohol consumption, it is essential to address the underlying emotional issues. Through therapy and support groups, healthier coping strategies need to be developed. Lastly, we consider reckless driving and impulsive behavior. Driven by the need to feel alive or escape emotional pain, this behavior not only endangers the individual, but also poses a risk to others on the road. If you or someone you know engages in reckless driving, it is essential to address the underlying emotional turmoil through therapy or counseling. Safer coping mechanisms can be developed, ensuring safety and well-being. In summary, self-harm represents a misguided attempt to deal with emotional pain. These behaviors are not solutions and often lead to more harm. If you recognize these behaviors in yourself or someone you know, do not hesitate to seek professional help and support. Remember, there is hope and healing with the right guidance, and you are never alone on the journey to a healthier and happier life. Thank you for watching. I'll see you on the next video.